Hello, and thank you so much for tuning in. I am Dr. Greta Anderson, and today we have an amazing show for you. We are going to learn a lot about some really important information and have the privilege of having Dr. Ross Radusky with us. I am going to share with you his amazing bio before we get started because I cannot do it justice without reading it. So bear with me, folks, here. So Dr. Ross is a board certified dermatologist at the Dermatology Treatment and Research Center in Dallas. Originally from New York City, he practices general and cosmetic dermatology. He is the proud inventor of SUNSHOTZ, the world's only sunscreen measuring cup, designed to help patients of all ages apply the proper amount of sunscreen needed to enjoy all the sun without the burn, and that's important. Dr. Radusky is well known for his interest in medical writing and editing. His work has been featured in ABC News, CBS New York, Allure, Men's Health, and Everyday Health Media. After graduating summa cum laude and Phi Beta Kappa from the City University of New York, Dr. Radusky received his MD from the New York University School of Medicine. He completed his residency in dermatology at the world-renowned Memorial Sloan Kettering Cancer Center and New York Presbyterian Hospital Weill Cornell Medicine. Dr. Radusky enjoys spending time outdoors with his wife, Robin, son, Oliver, and poodle, Lucy, where he can usually be found preventing photoaging and reducing the risk of skin cancer beneath an umbrella in a wide-brimmed hat. That's why he is the doc on here today. Thank you so much for being here, Dr. Ross. Yay!
Thanks so much, Dr. Greta. I appreciate that. Thanks for the introduction as well.
You are, needless to say, impressive in so many ways. But as you know, here on the Dr. Greta Golf Channel, we're all about golf, but we're also about getting smarter with our health, with our wellness. And of course, as I like to say, golf is the sport of the sun. So we need to talk to you. We really need to talk to you. So let's just get started here. If you could tell us kind of about the importance of sun protection, particularly for golfers, we'll just start there.
Yeah, golf is an outdoor sport. We know that we love the sun, but we also know that the sun can certainly be harmful when it comes to our skin.
Sure.
Not only does the sun cause 90% of our aging, so we're talking about wrinkles, we're talking about sunspots, we're talking about stretch marks, everything and anything. We also know that the sun is also responsible for many types of skin cancers. I've got a fact for you, Dr. Greta. There are more skin cancers diagnosed each year than every other cancer combined. So that is a huge, huge number. And we've been watching. Then combine, that's right. So more skin cancers are diagnosed each year than every other cancer in the United States. So it is a tremendous problem, and we know that. And so one of the ways that we could really help prevent that is by practicing proper sun protection. And that's one of the reasons why we created SUNSHOTZ. So, people are always asking, how many ounces or how much sunscreen should you apply to your body? And the answer is typically about an ounce of sunscreen. And for years, everyone's always said, hey, put a shot glass of sunscreen on, and that's all you need. Well, Greta, how many people are taking with them a shot glass on the golf course or to the pool or to the beach?
Right, exactly.
And so
some, but not many, exactly.
Some, that's not the norm. So SUNSHOTZ was the invention. I'd love to show it to you.
Absolutely.
So SUNSHOTZ is the world's only sunscreen measuring cup. It is collapsible, it is reusable, it goes around every sunscreen squeeze tube, and I'll show you what we have over here. So this is just an example. So basically, it just loops around every sunscreen cup, every sunscreen bottle. It opens up just like that, pop, and you can make it into a really cool cup if you wanted to. And there you go. And you take your sunscreen, you squeeze it. There's a little 1 ounce mark here that I'll bring close to the camera so everyone can see.
Perfect.
And you could feel comfortable knowing that you're applying the right amount of sunscreen. So you really just use your hands, you put it to your face, to your arms, to your elbows, to your knees, everywhere. Because, if I had to guess, what's one thing that most golfers hate when they return from the golf course? It's that feeling of a sunburn. It's those shoulders blistering. It's the legs. It's everywhere.
It's everywhere.
Yeah, so one of the ways that you really can provide the right amount of sun protection is
Mhm.
by using the right amount of sun protection using an ounce.
Absolutely.
And so that's what SUNSHOTZ really is. And I can't, stress the importance of it.
That is huge because I will say this. I mean, we talk about sunscreen, we talked about it for years, and and I'm very fortunate. My mom was vigilant. I could not leave out the door with it on because I rode my bicycle everywhere when I was a kid, and junior playing and that type of thing. But also then they didn't have the tube, so I had like this massive bottle of it. So I developed the habit of it, and she would just say, too much is better than too little. I mean, she would slather that stuff on. And so I kind of developed the habit, but no one ever talked about how much.
Yeah,
So that's important because sometimes people feel like, well, a little dab will do you. And even though they're, 6 feet tall, they've got it, the dab on the size of, amount of ketchup that they put on a French fry. So we're
that's
learning
right.
that that's not going to really cut it for us.
That's right. I hear a lot from family members and from patients, oh, doc, I put on sunscreen. I put on, and I ask, well, did you put on the right amount? And you're right, because basically one sunscreen bottle has about 6 ounces in it. So that should only last you, 6 applications. I'm going to ask your viewers, how many at home have kept the same sunscreen bottle summer after summer after summer? And
That
that's
is
simply
exactly
just
where I was going because many a golfer will pull out that tube from it. It's the same tube for years gone by, and I'm going like, but you play golf 4 days a week.
yeah.
The math is not working, right? So that
That's
leads
right.
us to an important question. Do we need to put it everywhere?
Yeah, great question. So, sun protection when it comes to sunscreen actually should come last. And I'm going to explain to you why. The first is you really want to protect your skin with shade, right? So you want to use umbrellas when you need it.
Yeah.
You really want to make sure that you're wearing longer sleeves if the weather allows it. So think
Mhm.
lightweight, cooler clothing,
Mhm.
think pants when the weather allows it.
Mhm.
Then you could focus on sunscreen because obviously nothing protects you better than shade and avoidance of the sun.
That's right.
Afterwards, you really want to make sure that you're finding and that you're hitting all of the exposed areas of the spots. That's the nose, the face, believe it or not, the top of the ears, particularly in men or with women with shorter haircuts. And I can tell you actually that that's a very, very common area to see skin cancer, unfortunately, the tops of the ears. Most people don't realize that. If you think about it, straight up, it's the sun. So we
Well,
just you forget that.
that makes sense. For years, I was a visor girl, and visors are great. So I don't want any visor companies coming at me. Nothing against them. But I began to realize for years, I wore my hair longer, not that the sun couldn't get through the hair, but once I went short and
Yeah,
got a little bit older and a little bit wiser, I just began to wear a wide brim hat. So my ears are always covered and I try to shade as
good.
much as I can and my scalp,
There you go.
because
Well, I'll shed some love to the visor company. Visors are just fine. Now there are actually a lot of hair sunscreens, believe it or not, that you could apply. They're lightweight. They come in a misty spray. There are a bunch of, recommendations that I could share with us later
okay.
that are wonderful because obviously you don't want to take a cream and just start
Yeah,
massaging to your scalp.
right,
But
right.
there are scalp sunscreens. That's really important. Don't forget the backs of your hands. That's one a
Ooh,
common area to show age. So one of my favorite
yeah.
photos that I have in my office is a photo of a young child, the mom, and the grandma, and it's just their
Mm,
hands together. And
yeah.
one of the things that really shows our age are the hands. So don't forget the back of the hands. Remember, you're applying this way, right? So you're applying on the top. So, and this is one of the
Right.
areas that when you're swinging is absolutely
Absolutely.
exposed to the skin. And then also don't forget the tops of your feet. That's another common area, especially if you're wearing, let's say, golf shoes, or you're not wearing, open shoes. So that's something really important. So missed areas of sunscreen. Don't forget there are some secret areas that I want everyone to remember.
Those are big. Wow. Look at that. That's so exciting. Now, so, no shade at the visor companies, but we like shade, but no shade at the visor companies, of course. But when you walk into the store now, it is daunting. There are so many types of sunscreen and so many forms of sunscreen. So, Dr. Ross, can you tell us or help us give us some guidance and advice on
Yeah.
the top or the best, let's just say that the best brands for us?
Yeah, let's dive right in. So there's two main types of sunscreens, and
Mhm.
we're going to break them up into those two big
Okay.
categories. There are mineral sunscreens, and they'll say it on there.
Okay.
Those have minerals like zinc or titanium in them. These
Okay.
are big molecules. They classically caused a very white cast across the face, but fortunately now they
Mhm.
come in tinted, so they really can match up to every color under the skin. They come in microionized, so they're really not as white and pasty as they used to
Okay.
be. These act like a shield. Think of it as a physical mask. They provide the best sun protection. The
Okay.
sunlight hits you and it bounces right back off of it. It does not penetrate the skin. So those are mineral sunscreens. Those are great for patients or for your golfers who might suffer from some sensitive conditions like eczema
Okay.
or from some psoriasis, which is very, very common. Phil Mickelson is a very famous golfer who suffers from
Mhm.
psoriatic
Yes.
arthritis and
Yes.
psoriasis. So if I had to guess, when he's out on the course, he's grabbing his mineral sunscreen.
Okay.
And the other type of sunscreen is called a chemical sunscreen. That's actually your classic sunscreen.
Okay.
Those have chemicals that are long, fancy bench, chemical names like
Yeah.
oxybenzone, avobenzone, octinoxate. And these sometimes get, bad news coverage. There are some
Mhm.
ingredients that aren't safe for the coral reefs, that aren't safe for certain patients, let's say that have sensitive conditions. They do get absorbed on the surface of the skin, but never inside, from what our research has shown us.
Okay.
And basically, the sun hits it. It absorbs it like a sponge. So remember, my other analogy was a shield. This is like a
Mhm.
sponge. So it just
Okay.
can't cause the damaging rays that can cause
Gotcha.
burning and skin cancer. The truth is, we as dermatologists, the best sunscreen that you use is the one that you use, that you like to use. You're
Okay.
right. There are
Okay.
so many at the drugstore that you could pick up. They come in different fragrances, applications, everywhere and everywhere. As long as it's SPF 30 or more, and
Okay.
it has the words broad spectrum,
Okay. Broad spectrum.
you're good. Now, of course, squeeze sunscreens obviously apply a little bit better. If it's breezy out on the course, the spray aerosols, they don't give you the proper coverage. So what I
Mhm.
usually tell patients to do is start with a lightweight chemical sunscreen if they don't have any of those other conditions that we talked
Mhm.
about.
Mhm.
That goes on easy, that goes on fast. And then the areas that burn,
Mhm.
the
Yeah.
nose at the end
Yeah.
of the day, the top of the ears, if you want to do your hands, then you could follow that up with a mineral sunscreen.
Okay.
So that's really how I like to approach the situation. Make it easy, make it fun, make it smell good. If that's what you're looking for, get it
Yeah.
on. Use SUNSHOTZ. Don't forget, you need an ounce of sunscreen to cover you from head to toe.
Mhm.
And
Mhm.
then to the trouble areas, you really want to make sure that you apply a mineral sunscreen.
Okay. So I love that. The best sunscreen is the one that we use, that we will use and use regularly.
Easy.
Start easy and apply consistently. And so, can you tell us again? Let's just say if we're out playing 18 holes of golf,
Yeah.
how often, because golfers like numbers, we like low numbers, but we like, numbers are important. How often should we be applying?
Great question. So the adage is every 2 hours, but a
Mhm.
little bit more frequently if you're a little bit more sweaty, or if you went into the lake in between
Yeah,
holes.
yeah.
So if excessive perspiration or water touch your body, you do want to reapply a little bit more often.
Mhm.
But every 2 hours is typically our recommendation.
Okay. Okay, that's important, because whether it's time or every other hole or some kind of way to, figure it out, it makes sense because whether it's the adults, but we also, I feel like this is an important is that number, that statistic you gave about this being um, uh, skin cancer, the frequency outweighing all of the other types of cancers in terms of diagnosis is daunting. But the good news is that we can really stem the tide on this with our young golfers by
Oh,
creating
absolutely.
good, smart new habits with them. Maybe mom or dad or grandma and grandpa didn't have those habits, but we can build smart ones right now. So that's really, really important to understand. So thank you. Now, I guess, unfortunately, as you mentioned, the frequency of diagnosis of skin cancer does happen. But what should we be looking for on our skin on a regular basis to, um, you know, in case we need to come see a person like you? What should we be
Yeah,
looking for?
Great question. So we always quote the A, B, C, D, E's of skin cancer. And I
Okay.
always start with E and work my way backwards because
Okay.
E stands for evolving or evolution.
Hmm.
A changing mole or skin spot is the most important reason to come and see a dermatologist.
Okay.
You are your best doctor, believe it or
Hmm.
not. You're your best doctor. You know your skin. You see it every day. And
Correct.
you definitely should be checking your skin specifically to look for new moles and new spots every month in the shower or in the
Okay.
mirror. That's something easy that everyone can do. It takes 5 minutes for you to simply take a look at your whole body, head to toe in a mirror in the bathroom.
Okay.
But you want to see if anything's changing. If you've had that mole for 30 years and you're just noticing it, you know what? It's getting a little darker. I think it's getting a little bit, a little bit larger. Then
Hmm.
that's something that you really want to bring to your attention of your dermatologist. I mentioned that fact, which is that we have diagnosed now more skin cancers than any other skin cancer combined. But remember, any other cancer combined. But remember that skin cancer is also the most treatable, especially when found early. And that's
That's good.
one of the real privileges of my career,
Yes. Yes.
which is that if we find someone who comes in early, we could absolutely save them from some of the harmful effects of skin cancers.
Yes.
So E for evolution, changing mole. D for diameter, keep them small. We like things to be smaller than a
Hmm.
pencil tip, but
Okay.
certainly no larger than a pencil eraser, right? So if you're
Okay.
getting something a little bit larger, definitely get that taken a look at.
Hmm.
C for color, pick a brown, pick a tan. You want to really avoid colors like pink, very, very dark black, and blue. So those are our worrisome colors in
Okay.
dermatology.
Okay.
B for border. So what does border mean? You really want to
Hmm.
be able to outline the whole spot in pen. If it's kind of leaking into your skin a little bit, you're not sure how deep it is or where it is, then that's definitely a reason to come to a dermatologist.
Okay.
And then finally, A for asymmetry. We like perfect circles. That's how the body should be creating them.
Okay.
If you've got Lake Michigan across your body, then
Uh-oh.
that's definitely something I want you to come in and definitely have us take a look at.
Very
Um,
good.
Now remember, golfers are outside in the sun all the time, so
All the time.
they will get a lot of non-cancerous benign spots. And so that's why I do encourage everyone to find a board certified dermatologist,
Mhm.
get a yearly skin exam, let everyone tell you, oh, that's nothing to worry about, nothing to worry about, nothing to worry about, because I'd rather diagnose 1,000 benign spots than obviously have someone just ignore that one spot that kept growing and became an issue.
Absolutely.
I have one skin tip for your golfers. The
Please.
best, if you're gonna schedule your annual skin exam, the best
Mhm.
time to do it is really well after the summer season. So if that's dead of the winter, if that's pre-spring, that's really gonna be a great time for you. And that's simply because all of those, remember I said all those benign
Yes.
sunspots that we
Yes.
naturally get,
Yes.
they've kind of faded a little bit. It reduces the background noise. So
Mhm.
your dermatologist can get a slightly more objective assessment of your
Okay.
skin without sort of the background noise.
Okay. So for those of us who live in areas where we play more seasonal golf, then that's certainly something
Yeah,
to factor in. And those who, let's just say, live somewhere where it's just hot and sunny all the time, they just have to make sure they make a point to get in there.
absolutely. Great advice, Dr. Greta.
Okay. So here's the question. So I'm gonna kind of have a couple of questions here on some myths.
Okay.
Um, because I kind of hear it all. Some people think that just because you're a brown girl or guy like me, that this might not be a factor, that melanin means I don't need sunscreen. True or false?
False, false, false.
Thank you.
So remember, there are two wavelengths of light: UVA for aging,
Hmm.
for UVB for burning.
Hmm.
It's the UVA rays that basically, cause weathering of our skin, that cause wrinkles and brown spots and color issues and dyspigmentation. And every person of every skin color under the sun suffers from any type of pigment issues. So if you want to help stop that, so if you really want to help prevent that, a good sunscreen is going to be your answer. And then finally, there are UVB rays, which are those responsible for burns, and that can lead to skin cancer. And we absolutely see skin cancers for every patient of every skin tone and color. So the old myth, which is that you don't need to put on sunscreen, if you're a person of slightly darker skin type, is a myth. It's been debunked, and unfortunately, we have seen lots of patients that have developed skin cancers in darker skin types, and we know that sunscreen can really be one of the ways to help prevent that.
Good. Thank you for debunking that myth. Also, here's another one. The sun shines in the middle of winter, but many golfers feel like, oh, it's not so hot. I don't need sunscreen. True or false?
Absolutely false. So the sun angle, depending on your latitude, definitely isn't as high in the middle of December or
Mhm,
January as it is in
mhm,
June.
mhm.
However, we know that during peak sun hours like 10 and 2, unless you're at the North Pole and the sun isn't rising, you still get rays that can cause burning and aging. Does it take a little bit longer? Absolutely. But remember, it's the work that we do around the clock. Our skin is an elephant, it does not forget.
Right,
And
right.
so, yeah, you might think, sure, it's January, it's February, I'm out on the links, no one's really, where's the
Yeah.
sun? It's getting you. You'll probably not going to sweat as much because it is cooler,
Mhm.
so you're not going to need to reapply as often,
Right.
but you definitely have to get that base coat out, especially if you're trying to prevent all of those aging signs like we've discussed.
That's right. And which leads me to this other one. Well, it's a great day for golf. It's super overcast. Oh, I don't need sunscreen. It's overcast.
Great myth, also false. You totally need sunscreen, even if it's overcast. And that's because there is still a UV index, regardless of whether it's overcast. The sun's rays can still penetrate it. There are still UVA rays. Those are shorter waves. Those cause aging. They can get through overcast sun. You probably, again, won't sweat as much. You might not need to reapply as often, but it's still super, super important regardless of the season.
Super and super important. So, and they're really, so golfers, what Dr. Ross is telling us is that we're going to wear sunscreen all the time. We're in the sun, whether it's bright and sunny or overcast, hot or cold. We're in the sun, sunscreen. We're going to get our sun shots, hang them on our bag. And I love the loop on there, by the way, because,
Yeah.
golf bags come with all these little loops and clips. It'll just hang on the side. It's perfect. Absolutely
Great
perfect.
tip. I love it. That's a great tip. Thanks, Dr. Greta.
Absolutely perfect. Absolutely perfect. And so we'll talk about that in a little bit more. But I had one more question for you. So unfortunately, many of us, maybe some golfers out there watching today, or friends and family of golfers have not did not have the benefit of great advice like you've been giving us today, Dr. Ross. Is there anything that can be done to kind of reverse some of the damage that the sun may have already done? As you said, the skin is an elephant. So some of that damage is already there. But is there anything we can do to kind of pull some of it back?
Yeah, absolutely. So first, if you feel like you've been neglectful to your skin, and that's okay, we take all comers at our offices. Certainly make an appointment for your full skin check at a board certified dermatologist and talk with them about some options. There are some options that have both cosmetic effects and also can help reduce the risk of turning into skin cancer. So we love that. And those can include some chemical peels, especially in the off season. That can include some resurfacing lasers, topical creams to help just, help revitalize the skin, build
Okay.
new collagen, toughen it up. Skin's an elephant, but even elephants can be trained, so we got it.
Yeah.
And so there's no reason why, even if you're someone who, let's say, for the past 10, 15 years has really kind of not done everything that you and I, Dr. Greta, have discussed
Yeah.
for the past
Yeah.
few minutes,
Yeah.
there's still time. It's still important to practice good sun protection, and you absolutely can help reverse some of the signs of skin aging, and that's great.
Thank you so much. Well, I've learned a lot. I mean, this is good. And as I said, I think that one of the things that we can do just to make golf better as we're growing and evolving the sport is to grow it and evolve it in all types of ways, make ourselves smarter, better golf and citizens in all types of ways. And so this is an amazing part of it, just being smarter, taking better care of ourselves and each other. So I appreciate that. Have you any other words of wisdom? I mean, you've got gazillions. You know so much about it. Anything else you want to share with us? Let us know how to contact you. Anything you want to tell us, because you're the man of the hour. So the floor is yours.
Oh, that's awesome. I wanted to, let's just touch base on just a few more things. So you
Sure.
mentioned children. So you mentioned children.
Yes. Yes.
Children are such an important reason to educate on sun protection.
Mhm.
So one blistering sunscreen, and most of us have been there when we were younger because we
Yeah.
just didn't know about sun protection when we were younger.
Mhm.
One blistering sunburn before the age of 18 can double a child's lifetime risk of developing melanoma. That is huge. So you really have to
What?
protect your skin. So that's why we try to start young. And it's really,
Oh my
really important. We
gosh.
know that the damage done when you're young is the damage that can lead you throughout your whole life. And so
Wow.
remember, I said an elephant, when you're a baby elephant,
Right.
You have nothing to worry about for decades and decades and decades.
Right.
But when you're in your 50s, your 60s, your 70s, that's definitely when we can still see some of that damage that you got decades ago. So it's really important to practice good sun protection when you're young, to teach your kids, to sort of show them, be good role models if you're hitting the course with them, show them that you're applying sunscreen.
Right.
You know, one of the reasons why we created SUNSHOTZ was
Mm-hmm.
just to keep it fun, right? Like we want to really just have it fun and have it entertaining, because, you know, it sometimes can be a burden for some. And so that's really something really important. Two, I just want to hark on the fact that, you know, the best sunscreen that you use is really the one that you go and use. We said that before. It's super, super important. It shouldn't be a chore. And find the fact or the factoid that I gave over this
Mm-hmm.
past hour to sort of say, hey, you know what? If I can stop some wrinkling, if I could look a little bit younger in the mirror,
Right. Right.
then maybe I should put on
Have
some
at it.
sunscreen. And
Absolutely.
that's really just what it's about. Or of course, if you know someone that's suffered from a skin cancer, if you have a relative or a friend, or even you personally, my message to you is go out and enjoy life. Get out, go hit the green. Don't be afraid. Just practice proper sun protection. Really make sure that you're applying sunscreen regularly. There is no reason why you can't get out and enjoy it.
Excellent. So it's habit building. It's just like developing the habits of, you know, good practice habits, good playing habits. We just need to incorporate it into the course of play. No pun intended there, or pun intended.
There you go.
I'm corny like that. Well, I got to tell you, this is great, and I could talk to you for a long time, but you got stuff to do, and I know you don't have all day to sit here and talk with us. Thank you so much, Dr. Ross. We really appreciate you being here and taking the time to share with us. I encourage each and every one of you to visit sunshotz.com, check it out. Grab a couple, grab one for yourself, grab a few for yourself, grab a few for your golf buddies. How about that? And I'm also thinking they make great golf goodie bag gifts. So tournament organizers, sunshotz.com.
Yeah.
Just saying that. Just saying
Uh,
this is, we don't need any more teas, but we do need sunshots, right?
Amazing. And a special gift to your viewers, especially as we're starting to turn the season,
Yes.
use code Greta20, Greta20, and for
Oh,
20% off any of your order for SUNSHOTZ. So www.sunshotz.com, use code Greta20, and you are good to go. So
we will
we'll see you on we'll see you on the links.
thank you so much for that. And on behalf of our viewers, thank you so much. And I will put, fear not if you missed that, I will put it in the description and all of the goodies below so you can take advantage of that great discount and stock up on those. Also, we're getting to that time. It's going to start stuffing some stockings and that type of thing. So these are perfect gifts. Excellent.
Amazing.
Thank you so much, Dr. Ross. I appreciate
Thank you.
here. And I will see each and every one of you out on the fairways. In the meantime, take care and be well.